Hello and welcome to the 2024 EUFOREA Global Chronic Rhinosinusitis with Nasal Polyps Awareness Day. Now today we gather once again to shed light on a disease that affects millions of people worldwide, which has recently been termed Nasal Polyp Syndrome. Now, since its inception in 2022, this annual Global Awareness Day has been at the forefront of a crucial mission, and that is to raise awareness about the debilitating nature of chronic rhinosinusitis with nasal polyps, or CRSwNP. But this year, there is a new focus. Over the next 45 minutes, we aim to put the patient front and center. Welcome to the Empowered Patient. Hello, I'm Dr. David Bull, and welcome to the third annual Global Chronic Rhinosinusitis with Nasal Polyps Awareness Day, hosted here in Brussels, in Belgium. Now, chronic rhinosinusitis with nasal polyps, which is also known as CRSwNP or Nasal Polyp Syndrome, is a chronic inflammatory condition affecting the nose and paranasal sinuses. It's estimated to impact about 1 to 4% of the general population and approximately 30% of patients suffering from chronic rhinosinusitis. The symptoms of CRSwNP, both physical and psychological, can be profoundly distressing for patients. Now, these include nasal obstruction, smell dysfunction with anosmia, continuous nasal discharge, facial pain, poor sleep quality, fatigue, anxiety, and depression. Now, as you would expect, these symptoms significantly diminish patients' quality of life. Now, unfortunately, many patients endure unnecessary suffering for years without receiving a proper diagnosis or a referral to a specialist for appropriate treatment. And this then begs the question, well, why does this gap in care persist? And how can we empower all stakeholders, that is, physicians, patients, and policymakers, to openly discuss CRSwNP whilst continuing to advance treatment options for patients worldwide? Well, let's start by talking about the patient experience. And this first section will focus on understanding the broad experiences faced by patients living with the condition. We'll explore the challenges faced by patients, including how they manage their condition on a daily basis and the barriers they face in actively participating in their care. Now, to bring the subject to life and to add real-life experience, we have brought together a plethora of panelists who represent stakeholders across the spectrum of CRSwNP. So first of all, let's welcome our patient representatives. From the United Kingdom, Dr. Catherine Shire. Dr. Shire is a patient. She's also a menopause specialist. She is also a retired general practitioner. From Canada, Jeff Prera. Jeff is the founder and CEO of 360 Story Lab, which specializes in the creation of augmented reality experiences for entertainment, education, and enterprise. He has had CRSwNP for more than 30 years and is a dedicated patient advocate working in Europe and North America. From the Netherlands, Ulkert Vals. Ulkert is the president of the Patient Association CRSwNP in the Netherlands. And from Spain, we have Victor Gascon Moreno. Victor is Vice President of Awareness and Operations at the Global Allergy and Airways Patient Platform, or GAP. Representing clinicians specialized in nasal polyp syndrome are Professor Witske Fokkens, EUFOREA Innovation Forum Director and Chair of the EUFOREA Chronic Rhinosinusitis Expert Panel. Joining her, Professor Philippe Gevaert. Professor Gevaert is an ENT specialist at the Department of Otorhinolaryngology at the University of Ghent in Belgium, and he's also a member of the EUFOREA Rhinitis Expert Panel. A very warm welcome to all of you. Thank you very much indeed for being here. So let's start, if I may, with the patients, because you're really important in all of this. I really want to understand what it's kind of like to live with CRSwNP on a daily basis. And Ulka, if I can come to you first of all, can you explain what it's like to have CRSwNP, particularly the symptoms that you've been troubled with?
Well, as a child, I always had a lot of congestion. I was always sneezing and my nose was always blocked. Difficult breathing. And about 15 years ago, I lost my sense of smell. So that's quite impactful for my life, not to smell your children, not to smell everything, have a bad taste. Besides that, sleep is a problem because you can't breathe through your nose. So you're tired all the time.
So when you were trying to describe this to your friends, to your family, do they understand how significant those symptoms are? Particularly, I think, the loss of smell. It's something that I think is very underrated, actually.
Yeah, absolutely. You can't get it over that, what the impact is, about impact on your emotions, for example. But also being a bit of tired all the time. It's hard to explain what it is and where it comes from. And then you got a name for a disease which is terrible. So I'm really happy with the new name because it gives a bit more, I hope, awareness and understanding with the people around me.
We'll come on to that a little later, but I'm delighted to hear you like the new name. Let's move on, if we can, to you, Catherine. You're particularly interesting, if I may say, because you're a doctor by training. Obviously, you're a retired general practitioner. And yet, even though you have all this knowledge, your diagnosis came quite late, didn't it? Tell us your story.
Yes, so I was diagnosed 2 years ago, which is when my symptoms became particularly bad and more chronic. But prior to that, I'd had recurrent sinus problems, infections, and a lot of congestion, a lot of rhinitis, which we assumed was allergic, and I did use a spray, but never realized the complexity of it. And since it got worse and I was diagnosed with Nasal Polyp Syndrome, I've also developed chronic asthma, which was new. I didn't have that before, although occasionally I would have a bit of wheezing. And looking back, I've had esophagitis prior to that, which potentially could be related, but nobody recognized that. And even as a child, I did tend to have sinus problems infrequently, but every time I got a cold, I got congested and I had a lot of coughing. So it hasn't been recognized, and I've probably had something there most of my life.
So it's so interesting, isn't it? Once you put the pieces of the puzzle together, in retrospective, with a retrospective view, it all made sense.
Yes, yes, but I didn't recognize that as a doctor, and possibly many of my patients have had similar problems which I didn't recognise.
And I think that is the key to all of this. Of course, GPs, doctors, very used to pattern recognition, but obviously in your case, that pattern wasn't recognised. Let's move on to you, if I can, Victor. You've been recently diagnosed, so you're at the other end of the spectrum in terms of the journey. Listening to your colleagues here, does that have resonance for you?
So in a sense it does. So my journey, as you know, I work with the patient organizations globally, so that means I care for every patient in the world except myself. So I have been living with this condition, I think, for, I would say decades, but I always blame it on living in places with high humidity or allergies, like my mother, right, which is probably also a patient. And I only took care of it when the symptoms were so bad that I couldn't sleep well, I couldn't work well. And especially in COVID, when your nose is like watering all the time, they may, the stigma, like, oh, this person has COVID or has a flu or something. And then you go to the gym and people stay away from you, and then you don't know, like, no, it's nothing, it's allergies, right? So you only take care when the symptoms and the quality of life is so bad that you, like, this is impacting my life.
So when did the penny drop, or how did it transpire that you were then given the diagnosis?
So I remember I was in an event, in a patient advocacy event in Milan, and my nasal polyp was already very big, and I couldn't breathe, and I was watering until my CEO told me, like, you need to take care of this. now because you cannot even work. And I was like, yes, I think it's time for me to go to the doctor.
And then you got your diagnosis. Let's come to you, Jeff, if I may. You've had this condition for over 30 years. You're, I suppose, a very experienced patient. Just listening to the other stories, does that have does that have resonance for you as well?
Oh yeah, David, it's really very, very familiar. You know, a lot of them alluded to kind of the progression, and that was my experience as well. Started off with simple, kind of a runny nose when I was a teenager, but you know, you just kind of take that for granted, and it got worse and worse, and it eventually evolved into chronic sinus congestion, and then eventually, you know, like a lot of people, I lost my sense of smell, and then I developed asthma as a result of that, and that made it difficult to breathe, and that really had an effect on my everyday life to the point where I was unable to work for, you know, briefly for a few days here and there. And it wasn't until it got to that point, like that bad, that my doctor referred me to, and I have an excellent doctor, but he had no idea what was going on. And finally I got a referral, fortunately, to a good ENT who diagnosed me. So
the chronicity got so bad, there was a tipping point where you just thought, I can't deal with this anymore, and that was the gateway to diagnosis. Let's move to you, Oka, if I may, just in terms of treatment. So when you were first diagnosed, I assume they said to you, you need to do first-line therapies. What did they tell you? What was the key to treating you at the beginning?
Well, at first, I wasn't even aware of having the nasal polyp syndrome. So I took a lot of, I thought I had an allergy. So I took a lot of, I went to an allergist, get a lot of tests, get diets, really severe diets. Couldn't eat potatoes, couldn't eat pasta, couldn't eat rice. But it all didn't help, so at the end I go to the ENT surgeon, specialist, and he said, yeah, you got nasal polyp syndrome, at least you got polyps, so we have to treat them and we have to get them out. So I got surgery and they got it out, and it helped. I got my scent back after 10 years, so that was really amazing. But after 3 months, it was over. I couldn't smell again, and I had congestion in my nose, so it helped for 3 months, and then I was back on the point I started.
And for you, I suppose, mentally, that was hugely damaging or challenging for you, because you thought you'd had the surgery, things improved,
yeah,
and then you were back to square one.
Yeah, because you think, if this doesn't help, what would help? And I was under the impression that I could never smell again, because I could smell again if I have another surgery, but you can't have surgery after surgery after surgery.
Indeed. Victor, on your journey, so then you got the diagnosis.
Yeah.
Does this also sound familiar? So they then said, right, first-line therapy, this is what you need to do.
So, well, in my case, so I have experienced 5 healthcares in 5 different countries in 2 continents, and I had the same problem with all of them. That you go to your primary care doctor, which is great, but there is always something else that is more important than what is happening in your nose, right? Like, I have this problem, doctor. Okay, but how is your cholesterol? How is your injury? And you have like 5 minutes, and then at the end it's like, okay, just take antihistaminics to reduce the symptoms and continue your life. So I've been in that antihistaminic, which no effect, just like quick relief, for like 10 years until I got the diagnosis in a proper allergist in Austria. And then they realized part of my nasal wall, part of the wall of the tissue of the wall, it has been gone. It was disappeared because of the damage. And until the point they said, like, you had surgery. And I said, no, I didn't. I never had surgeries. Then there is a piece missing there. It's because I haven't untreated for so long. The damage was very extensive, but I haven't lost the sense of smell or have asthma yet, I guess.
Okay, well, let's hope you don't. Catherine, moving to you. So this was a bit of a shock for you. You got your diagnosis, and then you start on the treatment. Was that the same protocol to say first-line therapies first?
Yes, I'd already been using a nasal spray, a steroid spray, for many years. They obviously introduced the nasal irrigation, but told me I needed surgery fairly quickly. And I had surgery in December, 18 months ago. So, and that did make some difference to my symptoms, but only for a short time.
So not like Urquhart. So in your case, it wasn't quite that revelation. Oh, look, I've had surgery. I'm much, much better. No.
No, it was better for maybe 6 weeks. I could smell a little, but my chest wasn't any better, and in fact that got worse. And then my nasal symptoms returned. It's not as bad as it was initially before the surgery. I don't have the constant headache and pressure now, unless it flares up if I get a cold or something. But I've asked my doctors all along, why is this happening? What's the underlying cause? What can you do about it? And never got an answer.
So that's a brilliant point, because I wanted to come on to that. How much pushback do you get? I mean, you are in an unusual position being a physician, but how much pushback was there for when you went to the doctors and said, look, there has to be an underlying cause, we need to do this, like, this isn't working for me? You saw a lot of pushback, did you?
Yes, it was just kind of dismissed, and they changed the subject. Well, we'll do some blood tests. Blood tests are fine. You just have to see how it goes and keep using the spray.
And Jeff, you're nodding along to that because this obviously sounds familiar.
Well, not, David, not because it's familiar, because it's shocking. The fact that you're a doctor, and because you have so much knowledge already about so many things, that you got that treatment. So you can imagine what would happen to a patient who doesn't have that kind of background and that kind of, say, credibility with the medical care provider.
And what about your own experience, though? Because obviously you have a different system of healthcare where you are. But did you find that they helped you on that journey, or did you have to push?
Well, see, I had a bit of a different experience. As I've said, I've got a terrific doctor, and we have a kind of relationship. We've always had conversations about my, whatever issues that it may be, cholesterol or whatever. So he was very open to these things. And he was like, honestly, I don't know, but here's what the standard of care is for symptoms like this. So we went down that path. But he did not have the kind of background or education or training to say, oh, yeah, this sounds like you might have, something that requires a different kind of treatment.
So that's really interesting as well. So it depends on the physician you see, how much knowledge they have about particular conditions. If I come to you, did you feel you were being treated properly, or did you have to, when you researched stuff, did you go back to the doctors? Did you push back and say, actually, I want something else?
The problem was that when I got the operation and I get the setback of it, COVID came in, so the communication with the hospital was stopped. So there were no appointments, etc. So there was no treatment again.
And obviously it was an extraordinary time across the board in every country, I think.
Yeah, so my problems were minor problems.
And does this, in terms of your story as well, again, you know quite a lot. And were you like fighting with the medical professional, or did you find them on side?
I had to have that conversation with my PC in Austria. I think like I have to sit down with her. I think it's time to take care of this. Because again, she was worried about all the stuff about my health, and I don't blame her. It's obviously important, but I need to have that step with her and say, what is next? How can I get this properly diagnosed and a solution that is not just antihistaminics?
So you had to push.
Yeah, I had to push.
Well, that's a brilliant place to pause that. Thank you very much indeed for the moment. Well, obviously we've heard from the patients. Let's now turn our attention to the clinicians and the healthcare providers. Now, as you would expect, these individuals play a crucial role in guiding patients through their treatment journey, and they facilitate their involvement in managing their condition. Well, today we have the great privilege of hearing from two esteemed clinicians who specialise in the treatment of nasal polyp Syndrome. Now, their insights into what we've been talking about, that shared patient care, shared decision-making, collaborative approaches to treatment planning, are really invaluable in navigating the complexities of CRSwNP and enhancing patient empowerment. Witzke, Professor Fockins, really good to see you once again. You've heard their stories, and it's really interesting, isn't it, saying they had to push in terms of the shared care. I know that you are a brilliant physician and you involve your patients. How do you do that?
I see patients that always saw another ENT surgeon before they see me. I work in a university hospital. The first thing that usually happens, and can be quite difficult in a discussion with the patient, is that you have to explain that it's a chronic disease. And I always explain that it's the asthma of the upper airways. Most patients understand that asthma is not something I'm simply going to cure with another surgery. And then that is the start of the journey together to find at least control of the disease and hopefully remission and eventually cure.
And so when you tell patients this, what's their reaction? Because I assume when you talk about chronicity, this is a condition you learn to live with. That's not quite the message they want.
No, definitely not. You know, because they usually refer to, this is this great surgeon who can do it much better than I could do it, and she will solve the problem. And, well, my first message is, I will not solve the problem. And that's usually a huge disappointment, of course. And that's very, very understandable.
Professor Hevart, does that sound familiar to you in terms of trying to talk to the patients? I mean, obviously you believe, both of you believe, that empowering the patients in this and giving them a voice is really important in how you plan the treatment protocol.
I always give them all the possible scenarios so that they can choose from. But the problem is, of course, that takes a lot of time to explain them what these are, and also the long-term planning of that. So say, you can do this, you can do surgery, you can maybe participate to a trial or get this drug. So you try to offer all the options and let them choose. However, that's very hard for them because they have to choose from themselves, and at the end, they understand that we are stuck in a difficult disease where you have no one solution that is working immediately.
And I suppose, Witzke, there's a level of understanding here as well, because if you set out all those treatment modalities, it relies on actually the patient having some understanding of what you're trying to say, the risks, benefits, and everything that's involved.
Exactly. If even a GP says, what sort of disease is this actually? What's the pathophysiology? What's the cause? Every patient wants to know, what is the cause of the disease? And of course, we don't know exactly, but we can explain a lot, like it's not an infection, it's an inflammatory process. That sort of things helps for patients to understand why you give a choice of potential treatments and where these treatments are directed to.
So just coming back to you, Professor, just in terms of setting all of those things out, is it always beneficial? Or is there sometimes an argument to say, my best advice to you is to do X, Y, and Z?
Yeah, well, that's the old style, saying, this is it, you have to follow this, and we will do that, giving them no choice. This is not how we work today. Patients won't accept that, and they are right. They should know the different options that are there. Although we have to realize that for us doctors, these options are also frustrating. For every year before, so the past 2 decades when we were working, we didn't have good options. We only had options like or surgery, or nasal steroids, or some rinsing. Telling do your
Systemic steroids.
The systemic steroids, yeah, but we don't want to give them lifelong. So it was very frustrating to be a doctor, and I think that the patients really feel that. When they tell all their stories, they feel that we are out of good options. We also didn't have the magic options that we really wanted to have.
And of course, Witzke, when just our panel here, they're all different backgrounds, different experience, levels of experience, whether it's clinical or what they've learned. And again, you have to tailor what you're saying to the level of understanding and how much they want to know.
Yeah, well, although, of course, you have to tailor the complexity of what you say to different patients, but I think in general all patients really want to understand what their disease is about. So I don't sort of say, oh well, you're too stupid to understand, so I tell you what's best. I always try to explain what disease is about.
And Professor Hevart, this is a tricky question. What do you think you do well, and what do you think you could do better?
I think I'm very good in explaining my patients what their disease is and what the options are. What I can do better, well, I think I still always have too little time. So my time slot is 15 to 20 minutes, and then next time they see me is 1 year later. So what I don't do well is I have no time. My time slots available for I would wish I would have more time for them, to explain them everything myself, but that's hard.
Of course. And Professor Fockins, this is really where EUFOREA comes in, isn't it? Trying to empower the patient, to get them to ask the right questions, so they come armed with knowledge. How does EUFOREA fit into all of this?
Well, what EUFOREA does is really, all the explanation I give can now also be found on the website of EUFOREA. So that's the first thing I now try, say to a patient, go there, look at the videos you're interested in, go to the written material, and come back with the things you don't understand. And another thing I think is really important, I always ask my patients if they want to record, especially if they're alone, if there's not a partner with them, record the whole visit, because we all know, and I know that if I go to the doctor myself, half of what they say is lost before you leave the hospital.
Absolutely.
So if you record the whole visit, you can listen back and say, oh, what actually did she say, and what do I have to do? So I think that's a really important advice.
So having been involved in this for some time, I think it's fair to say that patients' levels of understanding does vary. Now, EUFOREA has introduced a lay language term, we talked about this a little earlier, which is Nasal Polyp Syndrome, and this aims to help patients initiate conversations about CRSwNP with their doctor, as we heard, of course, often in a very limited time setting. Let me come, if I may, Ilka, you said right at the beginning, the idea of this, having something to hang your hat on, nasal polyp syndrome, was helpful to you.
Yeah, it's helpful to explain and to talk with friends and your partner and people around you that it's more than a cold. Yeah, because they think your nose is obstructed, you have a cold or something. But the meaning of a syndrome gives it more, impact. Or
And would you agree with that, Victor? Just in terms also about the chronicity, you're basically saying it's a syndrome. It's complex.
No, definitely. Having a right name that is easy to understand and pronounce by everyone is so important. We saw, I'm going to put my awareness hat now, we saw what happened with COPD, right? Very complex names. It actually doesn't work with, it does bad for awareness of the disease, right? Especially if in different languages. So obviously CRS with NP, that's a name that no one is going to remember and it's going to be so different in every language. So having one unified name for it is important, but we also have to consider, because there is also CRSwNP, it stands nasal polyp, so we have to find a way to bring everyone in that, everyone in the community with or without nasal polyps under that name somehow, to not exclude those patients who doesn't have nasal polyp, but they still have chronic rhinosinusitis.
And Catherine, for you, obviously you can see this from both sides, as a patient and as a doctor. What do you think of the term, A, as a patient, and B, as a GP? Do you think it actually helps the GPs having that term, that nomenclature?
Yes, I do. Because it makes it easier for them to communicate with the patients. I think the CRSwNP, they can understand as a doctor what the underlying pathology is and the problem, but the patients don't. And I think the fact that it also has the word syndrome in the title makes it so much have much more of an impact about the burden of the disease and the systemic nature of the disease. It's not just in your nose. It can affect so many different parts of you.
And Jeff, for you, obviously, as a very experienced patient, you've seen all of these changes going on. What are your thoughts?
The patients in this group and elsewhere, we worked with EUFOREA on thinking about different names and stuff. And it's difficult to come up with something that's inclusive. And I like the term nasal polyp syndrome. It's simple for patients to understand. It's simple to search for. And again, the word syndrome suggests like, oh, okay, stand back.
Well, so we looked at, I mean, they looked at lots of terms, didn't they, in terms of type 2 inflammatory disease, which again isn't very sexy, and I'm not sure that patients particularly understand that stuffy nose syndrome. Witzke, I know that not all medics love the idea of having a lay term. Your thoughts on that? Surely if it helps the patients, it must be a good thing.
Well, the good thing is that it's easier to explain. The less good thing, in my view, is that it says nasal polyp syndrome, and that implies that it's a disease of the nose. And it's not. It's a disease of the sinuses. And the sinuses are, well, half of your head. The nose is only, for most people think the nose is the tiny thing that sticks out of your head. So for that reason, you know, I think it sort of diminishes the impact of the disease on the quality of life.
That's really interesting. What are your views on that?
I think it's interesting what you say, because when I started 25 years, it was called nasal polyps.
Yeah.
And then it was changed actually by Witzke and the whole EPOS guideline group to chronic sinusitis with nasal polyps, which actually was a very great breakthrough, because therefore institutions, governments, healthcare, insurances understood that this was this kind of disease. We had one term, chronic sinusitis with nasal polyps. This was really breakthrough, because then companies started to invest in studies. So I think this was great. But nasal polyps was the original name, and maybe was for patients more interesting or more easy to use. The problem with nasal polyps is that, for example, in Dutch, it's also referred to this kind of adenoids. It's the adenoids that children that you can take away, and it never comes. Yeah, so
lymphoid tissue. Yeah.
Yeah. So when you talk about nasal polyps, in where I live, it was always like, okay, but you can take it away in children. Oh, I got it taken away when I was a child. So there was a lot of confusion. And I like this nasal polyp syndrome, because it says nasal polyps. This is understandable, but the syndrome makes it, it's a serious disease. It's something, if you have that, oh my God, you have that, we have to do something about it. It gives you leverage for healthcare insurances, for everybody around to understand that we need something better than just a nasal spray.
And that's a brilliant point about focusing the mind, and particularly R&D development of new drugs, for example, because obviously you see it's multifactorial. In terms of educating, we heard from the GP earlier about it is a useful term. How does EUFOREA try and educate clinicians themselves?
There's a lot of material on the website explaining everything from the pathophysiology to the management of the disease. And also there are courses. We just had a full day on new treatment options with biologics, and what are the possibilities and how to practically do that, for example. That's not only the theoretical background, but also what do you do in daily life with the patient in your room, and how to choose the best management for them.
Thank you very much indeed for the moment, everyone. Now, shared decision-making is a cornerstone of patient-centered care, allowing patients to actively participate in treatment decisions and align interventions with their personal preferences and values. And additionally, access to support systems and resources can greatly enhance patients' ability to cope with the challenges of living with CRSwNP and also navigate their care journey with confidence. The exciting news is today EUFOREA will be releasing the first edition of the Chronic Rhinosinusitis with Nasal Polyps Patient Guide. Victor, let me come to you. I mean, clearly you're very well informed. How well informed do you think you are?
Wow. I've been working in advocacy for 10 years, but I think I don't consider myself a medical expert or anything like that. So I'm well informed when it comes to awareness and working for the patients from the patient side. But
so pretty well. Urquhart, what your thoughts on how much you know, how in terms of the journey, how much do you think you know, and how much more would you like to know?
Well, as a simple patient, I think...
Nothing simple about patients.
There's a lot to learn, and there's a lack of good, simple information about the disease and about how to treat and what it is and what to do about it. So I think when we talk about shared decision making, you can only have shared decision making when you have the right information, and I think EUFOREA helps us to empower us to get the shared decision making going on. So
that's really important. I want to come back to that in just a second. Catherine, just in terms of your experience now, you're in this really interesting hybrid position in many ways. Is there more you want to know?
There's always more you want to know.
Yeah.
Yes, I didn't have that much information when I started this journey, and wasn't aware of the fact that there was this sort of chronic disease. And even when I asked the doctors and the specialists, you know, what's causing this, I didn't get any answers, and so I went searching Dr. Google, and that's how I...
Very dangerous, very dangerous.
Don't do as I do.
Exactly, I think we spend our lives saying, don't Dr. Google.
I know. Anyway, that's how I found EUFOREA, and it was amazing because I learnt so much from EUFOREA, and then I went to the doctors and said, have you seen about EUFOREA, and do you know about this? And they said no. So I felt I knew more than they knew, or that they were telling me.
And Jeff, you're really keen to talk about the relationship between doctors and patients.
Yeah, I want to get to that in just one second, but just in response to some of the other things, you were asking about you know, us if we feel like we have some expertise or knowledge. I was going to say, oh yeah, I was to say, oh yeah, David, I'm an expert in my own symptoms, but I realized that that's not even true, because I've had symptoms that I thought were unrelated to nasal polyps, and that I've discovered that they actually are. And there's just in the work that I do with other groups, I realize there's people have been reporting a kind of dizziness, not quite a dizziness, but a kind of disorientation that seems to be related with having chronic sinus congestion, which has causes some kind of vestibular dysfunction. It was news to me, this was now a few years back, that people had serious hearing loss as a result of sinus congestion. These things.
So you're nodding along, Witzke. Both of you are nodding along and saying, yes, this is true?
Yeah, absolutely. Yeah. Eosinophilic otitis media is a very severe and very debilitating disease that is linked to chronic rhinosinusitis with nasal polyps. And that also can cause the dizziness.
Yeah, I went to see one of my doctors, a specialist, a vestibular specialist, and they never mentioned that. They had no idea what that might have been.
Are you surprised?
Well, it's so, for us rhinologists, the ear is actually an extension of the nose through the Eustachian tube. So they don't want to hear that, the ear doctors. But it's the same inflammation that happens in the tube and in the ear, and that's what you can see. So in some patients it can really be severe, and we see those patients, so we know this association, but it's indeed harder to know, and you have to see many patients. I think we are in a privileged position in universities that we see so many nasal polyp patients that we start to see all the other diseases around.
And Jeff, you wanted to make a point about the doctor-patient relationship.
Before I get to that,
oh right, you're keeping us waiting.
Something else I wanted to add. You know, I was recently speaking to someone with nasal polyps, and she feels that her polyps get better or worse depending on what phase of her menstrual cycle she's in. So there is a whole universe of things that are yet to be discovered, or not discovered, but explained to people with, who are carrying the disease burden. And I think it's really what we need is a kind of different paradigm, a different way of working together with medical care providers. And it's not going to go back, David, because of the rise in social media and people are Googling their own symptoms, and I think that's actually a good thing. We don't always have the ability to understand completely what we're reading, but it gives us a foundation to ask some questions. And the way I think about it now, in terms of dealing with issues like this, it's like somebody, there's a mountain to be climbed. You show up at base camp and you think, okay, I need to get to this point, and you can't make it to the top of Everest on your own. You need talented Sherpas to work with you.
Of course.
And I think that for me, the sense is the patient has to prepare themselves as much as possible, present themselves at base camp to talented clinicians who will say, okay, you want to get here, so I can help you to do that. You're going to have to do it yourself, but I can help you. I'm going to be here with you and suggest you the pitfalls and a path that you can follow to get to where you want to get to.
That's a lovely analogy, actually, really good. And Urquhart, the role, Catherine was talking about EUFOREA, that she stumbled across, EUFOREA, that it helped her. Can I just ask you, in terms of the role of EUFOREA being almost that middleman of giving you information that's accurate and where it knows more than many clinicians, how important are things like the instructional videos, the pocket guide, for example?
I think it's really important that those kind of things can empower the patient and ask the right questions and have the right instructions before an appointment. So it's really helpful for patients. I'm worried. My worry is that the pocket guide. How comes the pocket guide to the patient? So. Now we can find them on Google, but in the real world, you want that your GP gives you the pocket guide, and there starts the journey for a lot of patients.
Catherine, perhaps I can bring you in there then. Just as a GP, isn't that right? That actually where we need to be is where, with many other conditions actually, where the GP says, well, here's some information. So whether it's about haemophilia, for example, or whatever it is, hemochromatosis, or whatever it is, surely the next thing is the GP says, right, and here's EUFOREA's guide.
Absolutely, yes, but the GP needs to be informed first. So it's getting it to the GP or whatever healthcare provider you see. That's the important step, as well as the patient.
Philippe, can I just ask you, what advice then would you give to anyone watching this, for example, who is struggling with their symptoms, caught between maybe a primary care clinician who doesn't know a great deal, maybe, and in the ping pong between them and the specialist and trying to access care? What advice can you give them?
I think the problem is there is a lot of nonsense on the internet and patients start seeking themselves. I see a lot of patients that found me through the internet because I had a lot of publication on the topic. But that's, of course, a lucky shot of those people, and that's not right. GPs can't know everything, and they can't know where the pocket guide is. So I think a good website and good information for patients that is trustworthy, without nonsense, is extremely important. And of course also not biased, because some hospitals might advocate we have the best thing to do surgery with, but that's probably because they want to do a lot of surgeries rather than to treat the patient in a good manner.
That's a really interesting point. Can I just ask you, I mean, in my experience of clinical medicine, you really need informed patients. What advice would you give to patients before they go to the appointment? And we're talking sort of belt and braces stuff here about knowing what drugs you're on, what your symptoms are, writing stuff down. What would be your response to that?
Write down your symptoms, all the symptoms, because then together we can go through the list and say, oh yeah, this could be part of the problem, and this I can't fit in, things like that. Very important. Write down all your medication, prepare yourself, know what you want to know what you want to ask. because the more the patient is prepared, the better discussion our time will always be limited. So the less we have to sort of teach during a visit, the more time there will be to actually discuss.
And Philippe, finally, sitting here with a group of fantastic patients, is there anything that you would like to add in terms of helping them to help themselves?
I think getting good information from your ENT surgeon is very important, but also for your GP. And well, I think, again, looking on the internet and finding the right information is what we should offer them. At this stage, we don't have this. So I can't say, okay, EUFOREA is now doing that. But we have still a long way to go in making this even more than only this, just this pocket guide. And so there is still a long way to go for us as a community to help our patients to find the right information. So at this stage, I can't do that. I can refer to the pocket guide, which is a great initiative. But we need to do more.
Well,
we have to bring more.
I daren't close this without going to you finally, otherwise I will be in serious trouble. Witzke, so just respond to that, but also the journey for EUFOREA has been quite monumental, hasn't it? So where are you now? Where does it need to go? And your concluding thoughts on the role of EUFOREA?
I think for patients, the most important part is be much more critical. You're the one who has the disease. You know, so many patients still are either in the doctors tell me what's best, or in the all doctors are crap. And both is not good. If patients would really help us by being critical, say, okay, you're going to do another surgery, what exactly are you going to improve for me? Huh? That's sort of very simple questions. What's in for me?
So put the doctor on the spot as well.
Yeah.
And then if I may just finish on the role of EUFOREA, we've heard EUFOREA has been instrumental in the journey for people. It's obviously getting cut through, but it has a way to go. What are your ambitions for EUFOREA?
Well, the most important part is I always look at the diabetes awareness in the world. They have been extremely effective in teaching patients, teaching GPs, teaching healthcare payers to know what the disease is about, to early recognize the disease, because that is a big issue, that it takes so long, so many patients who suffer for years and years and years before they find the right person. So I think awareness is the thing where we really have a long way to go, and that's probably why we have this day here today.
Beautifully done, Witzke. Thank you very much indeed. That brings our conversation to a close. Fantastic discussion and much appreciated. Thank you very much indeed to our patients, to Dr. Catherine Shah, to Jeff Prera, to Ulchart Vels and Victor Gascon Moreno. And thank you also to our experts, Professor Witzke Fokkins and Professor Philippe Gevaert. Now let's just step back and reflect on what we've learned today. I do think it's fair to say we've illuminated key aspects of how we empower patients with CRSwNP or Nasal Polyp Syndrome to take charge of their health. Now firstly, we explored the patient experience. We recognised the daily challenges faced by individuals living with the condition and the importance of providing support and resources to help them navigate their journey effectively. Then we looked at this from the healthcare provider perspective. We highlighted the crucial role of physicians and specialists in facilitating patient involvement and shared decision making. And it was really clear that by fostering collaboration and open communication, healthcare providers can empower patients to actively participate in their care plans. And finally, we focused on shared decision making and support systems. We emphasized the significance of patient-provider partnerships and the availability of resources to enhance that patient empowerment. And by doing this, we can then really achieve optimal outcomes. What is clear is that by working together as a community, that is patients, healthcare providers, policymakers, and advocates, we can make meaningful strides towards improving the lives of those affected by CRSwNP. Thank you ever so much for watching. I do hope it's been helpful, and see you soon.